Being here today or for tuning in. I'm joined today by Dr. Joe Cantor of the Department of Health. We're going to start off addressing some of the COVID situation that we're dealing with, and then we will cover the winter weather event as well and take questions. Obviously, we're still very much in this Omicron surge, and in just a moment, Dr. Cantor is going to go over some graphs that have information that suggests we may be approaching a peak, which would be obviously welcome because you can't start going down until you actually reach the peak with respect to this particular surge. But I can tell you that right now there is a tremendous amount of COVID in terms of cases and transmission and hospitalizations and deaths, as much as we've ever had in the state of Louisiana. And when we do peak, and we will at some point, I want everybody to understand it's not like the whole state rises and falls together. There will be some regions of our state that will be in a plateau, some will be declining, some will still be ascending. But what I can also tell you is that for several weeks, our baseline numbers on percent positivity, cases, hospitalizations, and deaths. And unfortunately, hospitalizations always lag a little bit, and deaths lag even further behind. We're going to be at very elevated levels for quite a while. Today, we are reporting 14,706 new cases. This week, as I think many of you know, we actually surpassed 1 million confirmed cases since the start of the pandemic. And I do want you to note, I used the word confirmed. There are a lot more people who have had COVID than the 1 million. We've always known that. We don't know precisely how many more, but there are a number of people who don't test either because they are asymptomatic or they're only mildly symptomatic. And now you have people who are testing, but they're testing at home and they're not reporting, and so that's not being captured. So we know that well in excess of the 1 million that we've confirmed have actually had a COVID since the start of the pandemic. Currently, we're reporting 2,367 people hospitalized across the state of Louisiana with COVID-19. That is an increase of 63 from yesterday. We also have 142 patients on mechanical ventilators. That is actually down to from yesterday. And unfortunately, and very sadly, we've had 37 additional deaths. And we're now at 15,283 since the start of the pandemic. Later this afternoon, Dr. Cantor and I will have a telephone call with hospital CEOs and medical directors from the Tier 1 hospitals from around the state of Louisiana to see what's happening at those hospitals, in particular, and what more we might be able to do in order to assist them. But what I can tell you is there's still an awful lot of work being done at our hospitals that are, quite frankly, short-staffed, both because of COVID and because of declining numbers of staff regardless, and an awful lot of patients, both COVID and non-COVID patients to take care of. Starting yesterday, reinfections are now included in our COVID statewide case counts. And of course, we're using the same definition of reinfection that we've been getting from the federal government. And I know you have to have a period of 90 days between being positive before it's considered a reinfection. I think Dr. Cantor is going to get more into that in just a moment. But that's something we said last week that we would start to do because those are new cases of COVID, and up to yesterday, we weren't really reflecting those in our daily counts. So we want to be as accurate as we can be in terms of the number of cases that we are reporting, and we want to be as transparent as we can be with respect to the COVID situation here in Louisiana. The health department has completed its analysis on the vaccination status of reinfections across the state. And as we expected from the data that we had seen from other states, The majority of reinfections to date have occurred in those who are not fully vaccinated. 66% of reinfections in Louisiana occurred among people who were not fully vaccinated. 83% of reinfection-associated deaths occurred among people who were not fully vaccinated. And so there's so many ways to say it and pieces of data to support it, but the bottom line is the single most important thing that you can do to protect yourself and your family, your community, is to be vaccinated and to get boosted when you're eligible to do so. You are 17 times less likely to be hospitalized should you contract COVID if you are vaccinated and boosted. You're 20 times less likely to die. Omicron has obviously been relentless in its spread. It accounts for just about 100% of all the cases in Louisiana today. But there have been more than 70 non-congregant living outbreaks. And what I mean by that are outbreaks not associated with settings like nursing homes and correctional facilities. More than 70 of those reported last week. That's more than we've had at any point in the pandemic in terms of a week worth of those outbreaks. More than half of those occurred among employees in retail settings who were not masking. Masking remains an effective way to reduce transmission. We're also seeing startling numbers among young adults and children. 6 COVID-associated deaths have occurred among individuals 18 to 29 years old since January the 1st. Obviously, we're only 20 days into the month. For some context there, since the start of the pandemic, and we're getting close to 2 years now, a total of 117 individuals 18 to 29 years old have died from COVID. And we've had 6 thus far in January. Cases in children less than 18 are rapidly increasing and account for the greatest percentage of cases among all age groups since the beginning of January. And despite the fact that many schools were unable to report due to the sheer volume of cases that are being experienced across the state and our schools, 8,735 cases were reported among K through 12 students last week. An additional 1,719 cases were reported among K through 12 staff members, and many schools had to shift to virtual learning because of staffing shortages. The Department of Education is reporting that more than 51,000 students have had to go virtual at some point since the start of school, coming back after the holiday break. Both nationwide and here in Louisiana, we're seeing an increase in COVID hospitalizations among all pediatric age groups. The highest number of pediatric hospitalizations currently is among those 0 to 4 years old. I know that Omicron's rapid spread has many parents and caregivers of young children on edge, and they should be. It's concerning because this is the age group that doesn't have vaccines available to them yet. So getting vaccinated ourselves and wearing masks is the best way to protect those young children that we all love. Some good news on the national front is that the White House announced recently that additional resources will be made available in the fight against COVID, and that includes the public now being able to order up to 4 free at-home antigen tests per household, and these tests will be shipped directly to their homes, making tests more accessible and available to everyone. And you can place your order by visiting covidtests.gov. That's covidtests.gov, or you can call, for those of you without internet or you just prefer to make a phone call, you can call 1-800-232-0233. Now, there's going to be some period of time before those tests come in, obviously. If you are in need of a test, and you should know that on any given day, there are well over 400 locations in Louisiana where you can be tested. And if you want one of those locations, the easiest thing to do is call 211. and you'll be able to find out the locations in your area where you can be tested. Also, as we mentioned last week, private insurers are now required to cover the cost of up to 8 at-home testing kits per person per month. And then most recently, the White House announced that it will start shipping 400 million free N95 masks nationwide next week. The masks will be distributed through community health centers and retail pharmacies. Dr. Canner, as I mentioned, has additional information on our current trends. And so I'm going to ask him to come up, go through that information, and then take your questions. And then when I come back up, I'll give an update on the winter weather that we are starting to experience now in the state of Louisiana, what we expect to come over the next several days. And then I will take your questions as well. Thank you.
Good afternoon. On behalf of Secretary Phillips and LDH, I'd like to thank you, Governor, again for your leadership throughout this continued crisis. And as the Governor said, I think there's reason to believe that we're likely in the process of peaking right now. This is after another week of record numbers. You never really know for sure that you've peaked until you're on the other side of it. But as the Governor said, there's 2 points to make to that. Number one, it's likely that certain parts of the state might still experience increasing numbers, even if the statewide numbers do show that they are peaking and might be going in the right direction sometime soon. And the other point to make on that is, once you've peaked and coming down the other side, you're still awfully darn high. So if it is the case that we are peaking now, and if the numbers do, on a statewide basis at least, look to be trending in the right direction in the coming days or week, it's still worth remembering that that's still, as an absolute level, very, very high, basically the same place that we are now, which means it is true now and it will remain true for the next couple of weeks that there's just more COVID out there in Louisiana than at any point prior in the pandemic. The risk of being exposed, the risk of contracting, the risk of bringing COVID home to your family is as high, if not higher now, than at any point prior. And I think that's important for folks to realize as we watch these numbers closely in the coming days. We remain deep in this Omicron surge. Omicron is over 99% of all new cases nationwide and here in Louisiana as well. This graph that we're showing now is our incidence or new cases diagnosed day on day on a 7-day average. As the Governor said, we acknowledge that it's an undercount, even though we surpassed 1 million total recorded cases earlier this week. We know it's an undercount because some people don't test for any number of reasons, and many more people these days test at home, at a rapid test at home, and those cases never formally get logged either. So as high as that is, it really is an undercount. This past week, we again hit a new record. We had 1,806 cases per 100,000 residents over the past 7 days. That's up from just over 1,700 the week prior, which is up from just over 1,000 the week prior to that. And I'll remind folks again to take stock of how high a number that is, that the CDC gives 4 categories of community transmission risk from low to highest. And if you have over 100 cases per 100,000 residents in a week's period, that's enough to put you in the highest of those 4 categories. And now for the fourth week in a row, we've had well over that. 1,800 compared to just 100. So really just a astronomical number of cases of COVID out there. This is the highest amount of COVID at any point prior in the state of Louisiana. All 64 parishes are obviously in the highest of the 4 community transmission risk categories. We had over 70 logged outbreaks in non-congregate settings this past week. That's a new record for the state of Louisiana. And over half of those were in retail settings where there was not masking. So, for folks who go about their day-to-day business, we need to know now and for the next 2 or 3 weeks, there's still a lot of COVID out there, a lot of risk of being exposed to this very transmissible Omicron variant. The governor mentioned the very high numbers that we're seeing in schools. Anyone who works in a school or has kids that go to school know that that's been a challenge, and those numbers, as the governor mentioned, are an undercount because schools very understandably are having a tough time keeping up with those numbers. The next slide, please. We'll go through the same kind of other graphs that we usually look at every time we meet. On the top left, we have COVID-like illness, and this is the percentage of ER visits across the state that are attributable to people seeking care for symptoms that could be COVID or suggestive of COVID. This is the second week in a row that we see it going down. It was 12.5% of all ER visits last week. It's down to 11.5% this week. That's encouraging news. I do think part of that is potentially because we're continuing to message to people not to go to the ER if you don't have to, and that diverts some volume away. But I also think we are seeing an absolute decrease in people seeking care for those symptoms, and that's reassuring news. On the top right is the same incidence graph that I just showed, zoomed in a second ago. On the bottom left, we have a combination testing volume and percent positivity display. So testing volume is the line graph part of that. We have another new record week for testing. We tested 558 residents per 10,000 per week. That's up from 548 the week prior. That's a new record for the state of Louisiana. We've already surpassed 1 million tests just in the month of January. We're doing more testing than ever before in the state of Louisiana right now. On the bottom, we see percent positivity, and one piece of encouraging news for us is this is the first week in a while we've seen a decrease. We went down from, we reported last week, 28.6% positivity, now down to 27.5% of all tests being conducted are coming back positive. So that's a reassuring point right there. Then over on the bottom right-hand side, we have our number of people who are currently in inpatient hospital beds with COVID right now. Fortunately, we continue to go up. Today, there are 2,367 patients with COVID in inpatient beds throughout the state. That is the second highest point we've ever had, second to the peak of our Delta surge a few months ago. Of those, about 2,300 people who are COVID positive in hospitals right now, 72% of them are unvaccinated, and 95% of them have not been boosted. And as we see with Omicron, the importance of being boosted is much greater with the Omicron variant. As the governor mentioned, we unfortunately logged 37 new COVID-related deaths today, and this goes to the point that with Omicron, although on average we are seeing milder illness, that's just an average. And that doesn't mean that people are guaranteed to have mild illness, and some people certainly are having severe consequences with Omicron, so that should be a warning. We added 4 new cases of multisystem inflammatory syndrome in children this week. 3 of those cases are in critical condition in pediatric ICUs. That's a severe marker as well. We had 33 kids admitted to the hospital with COVID this past week. There's been 199 kids admitted to the hospital during the month of January with COVID. And I'll also remark, when you break out that measure, this is kids between the age of 0 to 17 who are admitted with COVID, over the past few weeks, kids 0 to 4 years old represent the largest share within that pediatric age group. Those, of course, are kids who have the least protection because they're not yet eligible to be vaccinated. This goes to the point that families need to be taking measures while we're in this surge to protect not just the older people in the family, but the younger kids too. And that means that folks who are eligible to get vaccinated should, and people who are old enough to wear a mask properly should be doing so when they're in higher risk settings. Again, with COVID, and particularly with Omicron, on average it's mild, but you don't know what type you're going to get. There's no guarantee that your case of Omicron will be mild, and families need to take stock of that. Next slide, please. As the governor mentioned, as of yesterday, we are now adding in reinfection numbers to both our cumulative case count, which is now over 1 million. It surpassed 1 million before we added those in, by the way, and to our new daily case count. We had been tracking reinfections the entire time, but only recently have we started adding it into the total case counts. We consider a reinfection anyone who has a positive test for COVID and then another subsequent positive test at least 90 days after that test. That meets our definition as a reinfection. Of the new cases that we announced today, about 1,500 of those are reinfections, and of the over 1 million cases that we have had throughout the course of this pandemic, just over 45,000 of those are reinfections. Next slide, please. The amount of reinfections that we have seen has skyrocketed with the Omicron surge, and the graph you see now represents that. These are the number of reinfections on a monthly basis, and we have increased the number of reinfections that we're seeing about 6 times from what we saw in our Delta surge in July and August. This speaks primarily to the need for boosters. We know that the protection one gets from the vaccines does wane a little bit over time, and we also know that added protection is needed for Omicron. For people that are fully vaccinated, and that means that they got 2 shots of Pfizer or Moderna or 1 shot in J&J, if those Pfizer and Moderna shots were over 5 months ago, or if that J&J was over 2 months ago, we strongly recommend you to get boosted for 2 reasons. It's going to bring your protection back up to really where it would have been before it began to wane, and it's going to allow you to combat Omicron more effectively. You really do need a booster to have adequate protection against Omicron. What the studies have shown essentially is Omicron evades the protections from just 2 doses of the mRNA vaccines, but once you get boosted, it brings your protections about to the same level that you had against Delta. So boosters are so important against Omicron, and that's one of the reasons why we're seeing so many reinfections with Omicron. Next slide, please. This is a slide of cases in nursing home settings that we've shown periodically, and we haven't shown it in a few weeks. I know Julie asked about it last week. She's not here, but I do want to give a little more data on what we're seeing in nursing homes. Nursing homes are stretched just like hospitals are right now for a few reasons. A lot of COVID is going around. Their staff is, of course, not immune to that, calling out sick, and they're having to mitigate these outbreaks just like a number of other settings are. So this week, we had just over 1,000 new cases of COVID in nursing home residents. That's up from about 700 last week. We had just over 1,300 new cases of COVID in nursing home staff. That's the gray line you see, that's quite high right there. That's a little bit down from last week. Thankfully though, because we have a decent base of vaccination in nursing home residents, we've not yet seen any substantive increase in deaths amongst nursing home residents. So that's the orange line you see at the bottom. To walk through this graph, you see the gray line, which is cases in nursing home staff, go up quite dramatically, then come down a little bit the past week. You see the blue line, which is cases in nursing home residents, go up. But just like what we saw with the Delta surge a few months prior, we've not seen very much movement at all, thankfully, in deaths amongst nursing home residents. Now, it is a lagging measure, so we might see a couple more trickle in over the next couple of weeks. We know that deaths are a little of a lagging measure, but we are thankful for the degree of protections we have from vaccinations in nursing homes, although we can always do better. I'll tell you, 57% right now of nursing home residents in Louisiana are boosted. That's significantly more than the general population, but not as high as we really want it to be. And the same goes for staff. We only have right now 16% of nursing home staff boosted, and we'd like to see much more than that. And I know nursing homes are working hard to achieve that. Next slide, please. I'm going to talk for a second about masking before I close. And due to the increased infectivity of the Omicron variant, wearing a higher quality mask and one that fits you appropriately is all the more important. So we recommend that you wear the most protective mask that you can wear consistently and that fits you well. Ideally, that's something like an N95 or a KN95, those masks provide the highest degree of protection. And again, because Omicron has proven to be so transmissible, I think the importance of this guidance is all the more valuable and pertinent now than it has been at prior points in the pandemic. I'll tell you, as we weather this surge, and also as we look ahead to the future, after this surge, it's more important for us to take stock of how to best protect ourselves and how to best protect our families. That starts, number one, with anyone eligible being vaccinated, fully vaccinated and boosted. And I think it also includes masking and being discerning of what your risk environment is. When you're in a surge, I think it's incumbent upon us to be discerning of what indoor spaces you are in, what outdoor crowds you are in, and what type of protections you take when you are there. And wearing a well-fitting, high-quality mask is one of the more important of those protections that you can take. Before I take a couple questions, I do want to just comment, speaking of the weather, and I know the governor mentioned this, with the cold weather coming in, I want to just briefly talk about home heating safety. And I'll tell you, we can and do see fatalities from carbon monoxide poisoning from people attempting to heat their homes from ovens or stoves every year. That's an avoidable death. Never use an oven or a stove to heat your house. It can lead to carbon monoxide poisoning. We can and do see fires connected to space heater use. There was a tragic fire in New York City just a week or two ago on that level. So if you do need a space heater, make sure it's properly fitted on the floor and well away from any clothes or linens or drapes or curtains, anything like that. And although this is not expected to be a widespread power outage event, if you do have to fire up a generator, that should be always outdoors and always well away from your house. Again, we see carbon monoxide fatalities nearly every storm we have, and they're largely avoidable. Pause there. I'd be happy to answer any questions if there are any. Yeah.
Hey, Dr. So I was wondering how the vaccine numbers are around the state, and if LDH is considering any additional vaccine incentives for boosters.
Yeah, nothing's off the table right now, but I have no announcement or no imminent plans to announce on the incentives. You know, we're doing better than we have in the past. We got 51% of the general population of Louisiana is fully vaccinated. 34% of those individuals are boosted. It's over half the state of the Louisiana is fully vaccinated, and that includes people that aren't even eligible. So I'm encouraged by that number. I think we need to get better. You know, across the country now, more people are vaccinated than any number. More people are vaccinated than watch the Super Bowl, if you look at the numbers. So I'm encouraged that it continues to go up. Every week we've been adding between 2,000 or 3,000 new people getting their first shot for the first time. Those are people who, for any number of reasons, have not for what is now just under a year of eligibility and decided to this week. So that does provide me encouragement, and I think we need to continue having these type of conversations. There still is a lot of mis and disinformation out there, but people still yearning for answers. It's a very common question. So I would encourage people, if there still are unvaccinated individuals in their lives, family members or coworkers or anything, it's never the wrong time to have another conversation about it. There's good data out there. Every week now we get more data showing the power of these vaccines to particularly prevent severe disease and death, what they're really designed to do. So I would encourage people not to give up. We haven't given up, and continue to have those conversations. Every now and then you can convince someone, and that's a measure for their safety, their family's safety, and the safety of those around them too. Thank you.
When it comes to this surge, we've heard a lot about case numbers and reinfections and things like that, and you kind of touched on it a little bit with the nursing homes, but I wanted to ask, with this particular surge, what does the data show around the number of deaths, particularly amongst those who are vaccinated?
For people who are fully vaccinated right now, that it's somewhere in the high 50% of individuals who die are unvaccinated. When you look at people who are fully boosted, the numbers are much, much lower than that. When you break that down farther, there's quite a big age disparity. So the average age of someone who dies from COVID and is unvaccinated is about 10 to 12 years younger than the average of someone who dies from COVID and who is fully vaccinated. But when you take a step back and look at that, and these vaccines, even though their effectiveness at preventing asymptomatic infection and preventing transmission does wean over time, and also has weaned with the Omicron variant, their value in preventing severe disease and death is still very high. That said, it's not absolute. And the vaccines don't provide the absolute same amount of protection for everyone. People have immunodeficiencies, everyone is a little bit different. And just like we see with other vaccines, there are people who, no matter how many doses they get, might not mount an immune response that provides them protection. And for those people, it's important for those around them to do what they can to reduce the spread, which includes being vaccinated and masking and all the other things that we talk about. Yes, ma'am.
Since we're nearing the peak of this surge, does it look like we're going to need that extra help in the hospitals like we have in the past?
We've been providing that help throughout this surge. So as of today, we're providing direct, we being the state of Louisiana, direct staffing assistance to about 60, I think it's 61 hospitals right now, and that's an extraordinary measure. We began doing that in the Delta surge. It's through staffing agencies, and it's hospitals that are having a hard time meeting the demand, both because of the number of patients coming in and because their own staff is getting sick with COVID like everyone else is. So that's in and of itself an extreme measure. It's a marker of the emergency that we still find ourselves in, and we hope for that no longer to be necessary at some point in the future, but right now it unfortunately remains necessary. Okay. Thank you. Please stay safe tonight and tomorrow morning.
Thank you, Joe. And you know, with respect to the effectiveness of the vaccines and the boosters, I was really pleased that Joe brought out the nursing home slide again today, because I don't think there's anything that really demonstrates how effective vaccines and boosters are at protecting people from severe illness and death. When you especially look at the residents on that slide and know that practically every one of those individuals is more vulnerable to the disease, more likely to have a severe outcome, but because we have such a high number of those residents who are fully vaccinated and boosted, you haven't seen the number of deaths rise like we've seen in previous surges, especially like at the outset of the pandemic. And so I think that is very clear evidence of just how powerful the vaccines and boosters are in terms of protecting individuals from severe disease and death. With respect to the weather, this morning, the folks at GOSEP had a regional call with offices of emergency preparedness around the state to make sure that they were aware of the winter weather coming in and what they could expect. Today at 1 o'clock, we also had a unified command group meeting that included a National Weather Service briefing on the winter weather advisory that has been issued. And it's been issued for Southeast Louisiana. And the reason Southeast Louisiana is the area of the advisory is that's where we're going to have precipitation in advance of the cold weather. So there's cold weather all over the state of Louisiana. You're going to have freezing temperatures and even lower wind chill values. And so there's work for everyone to do in terms of protecting people and plants and pipes and pets and so forth. But the winter weather advisory is in Southeast Louisiana. And that's because of precipitation that should be relatively in low amounts, but it could be a drizzle late tonight and into the morning across portions of Southeast Louisiana. And so there is a possibility for some accumulation. And the National Weather Service really talked about in terms of a glaze, less than 1/10 of an inch, that certainly will not last into the afternoon tomorrow anywhere. And so that's what we're looking at. The freezing temperatures obviously are going to return each night of the next several nights, but without any precipitation. So the most severe weather we're expecting is in southeast Louisiana overnight and into tomorrow, but there will be cold weather all over the state for the next several days. And I want to urge people to understand that forecasts are forecasts, and sometimes they overstate the weather that we're going to get, and sometimes they understate. And so we all need to be weather aware, paying attention to what our meteorologists are saying and so forth. The bottom line is we're expecting at least a trace of wintry precipitation in southeast Louisiana and several nights of freezing temperatures with wind chills in the teens across a big portion of the state. GOSEP has opened a WebEOC incident and activated its crisis action teams as well. They are monitoring requests from local government. Quite frankly, we're not receiving many of those, but we have received a few. And we obviously stand at the ready to offer support to local emergency managers. We are not, in advance of this weather, going to have any office closures, state office closures in effect. But there may be some local closures, especially as it relates to schools. So we're encouraging everyone to pay attention to what may be announced locally, whether it's from your school system or from your parish president, police jury, and so forth. And obviously, we always encourage you to follow the directions of your local officials during any severe weather or other emergency event. Please make sure that you check on your elderly neighbors, those who may have trouble staying warm or making sure that they have what they need over the next several days. Practice caution when using space heaters, electric blankets, fireplaces, generators, and Dr. Cantor went into that. The good news here, and we got a briefing from the Public Service Commission to this effect, based on the forecast, we're not expecting power outages. You may remember that last February we had a winter storm with a lot more precipitation, and you ended up with more trees and tree limbs knocking power out as those ice accumulations became so heavy that the trees gave way, or that the ice accumulations on the lines themselves caused problems. And then that cascaded into loss of electricity, water systems, and impacted hospitals and so forth. We are not expecting that this year because the precipitation will be such a short duration and such a small amount, at least as forecasted. Having said that, please be very, very careful when you're out and about. Understand that bridges freeze first, and we will have DOTD crews out, and they will be spreading ice and brine. We're going to try to find any ice and take care of it. We're going to mark it as soon as we can, but you might be the motorist who discovers it first. And obviously, if that happens, it's not going to be marked. So everyone should be particularly careful when you're out and about driving, especially tonight and early tomorrow morning. So let's be cautious in the coming days. Let's take care of one another. Let's remember that COVID is obviously still very much among us and presents a tremendous threat to public health. And just like we ask you to please be a good neighbor when it comes to COVID, let's be a good neighbor when it comes to this cold weather as well. So with that, I will take a question. Yes, sir.
Thank you, Governor. Good afternoon. During the President's press conference yesterday, he said his administration has made significant progress during their first year in office, despite several members of his own party showing frustration with his ability to move his agenda forward. As a Democrat yourself, I was hoping we could get your take on the President's first year in office and how you would grade his performance. Well,
first of all, I don't grade others. I'm not going to do that. But I will tell you that we had an announcement yesterday of $2.6 billion in additional coastal protection efforts and flood control efforts that would be administered through the Corps of Engineers. And that's obviously very much welcome. That's on top of funding that we receive through the Infrastructure Investment and Jobs Act that is going to be significant for us. We've talked about the $6 billion for transportation, for example, and the additional money for broadband, for water, for sewer. All of those things are obviously very helpful. The budget that we're going to present to the legislature next week, we're going to talk about the remainder of the American Rescue Plan funding that's been made available to the state of Louisiana. We still have about $1.4 billion that we wouldn't have, and we're able to take care of a lot of COVID-related expenditures in terms of things like the Unemployment Insurance Trust Fund, for example, water and sewer projects there as well. So I will tell you that much of what they've been able to accomplish and has been very helpful for us. Obviously, there's still an awful lot of partisanship there and gridlock, which isn't serving people well. You don't see the two parties working together and compromising and moving as many big things forward as we would like. And I think that would best serve not just our state, but the country. How much do I put that on the president? There was too much of that before him as well. It just, things haven't gotten better. And quite frankly, there's enough lane to go around for everyone. But there are a lot of things that they've done will be very, very helpful for the state of Louisiana. And if you just pay attention to the budget presentation next week, you will see that. Any other questions? Well, look, I want to thank you all for continuing to cover this. And I know I'm tired of talking about weather events, storms. I'm tired of talking about COVID. But just because we're tired of it doesn't mean that they don't happen or that the problems go away. I wish it were that easy. And so I'm encouraging people to continue to do everything they can to protect themselves and their families and their communities, to be safe, exercise caution overnight and into tomorrow with respect to the road conditions and with respect to the weather over the next several days. And again, I ask you to please be a good neighbor and check on those who are elderly or otherwise may need a little assistance. And let's make sure that they can safely stay warm and that they have what they need to get by until the weather warms up again. Thank you all very much, and God bless.